digital health. Thank you very much.
Thank you very much, Professor Ahluwalia. That was absolutely amazing and mind-blowing to think of the enormous burden of disease and the challenges faced by students in the country. I've got a few questions for you. One of them I was thinking, have you been able to measure the impact of these interventions so you can actually see that it's making a difference?
Definitely, Rosemary, you're absolutely right. You know, there's no point investing into technologies and into systems when you can't measure impact. So we got a very robust M&E system. The biggest impact that we could see was, could we survive the COVID period in the last, say, 12 months when we were immense into lockdown? We didn't have access to enormous population like we used to have in contact learning systems. The question was, can people still have the appetite to continue with services and curriculum programs? And we only could do that in reaching our targets, like the way we did with contact learning was to measure if these people will be happy to do the checks through these systems and being linked to services. And we absolutely, we just dropped down our targets just by 15% only, as much as we could have lost probably the entire 100% because we actually had no measures to reach out to the population. The health check itself is a great impact system. If you look at our ratio of our positivity rate, testing positivity rate versus the national positivity testing rate, it's been still far lower comparatively. Though we are a congregate setting system, we also have, if you look at South African data of positivity of COVID-19, the highest population who's positive is between the age of 21 and 30, and the second highest population is 30 and 40. If you look at the post-school system population, we're in the same bracket of population. But our positivity ratio has been far lower comparative to the national ratio. And we do think that these systems have played a role in the impact towards this, because we still had 1.4 million people in contact learning with invigilation of exams, with contact exams. So in a nutshell, we've seen mental health, we've seen far better response than our own contact learning, because we can now centralize telehealth to a large population in rural and other places, then we could even practically do it even in contact learning. So sometimes we've even seen a massive major impact advantages rather than the reverse ways at this moment.
Okay, thank you. Then, you know, we're about 15 months into the COVID pandemic, and have you seen any kind of fatigue? We were all feeling a bit of fatigue in the use of health check, and how have you dealt with that?
Massive. We always see this, the curve goes high. And so when we were in the first wave, the health checks were being used aggressively. People were scared, and many people are scared. They go into these platforms, they need these green passports. There's more vigilance from the security and cleaning people who we've trained and capacitated. So what we've been doing is, whenever the wave drops down, at that time, we know the people's fatigue will come. That is the time we go into a very aggressive communication methodology through our established 13,000 volunteers and our frontline team, so that they also do not have fatigue. They are then risen up to keep the momentum going, and that's been our system. And the other thing is, when the wave comes quickly, we do see the same impact on our system, even though not higher, but it does impact because people's families and things are in the same system. And the outbreaks in our own institution lead to a higher uptake of health check. So we're just doing the high communication during the low tides, and automatically it picks up in the high tides. So we're doing that balancing trait, and we've been able to, but we do see that fatigue is basically where we do fail a lot in time.
Yeah. So you mentioned that you had 13,000 peer educators or foot soldiers, and How have you recruited them, and what incentive have they for doing this frontline work?
So they've been with us since last 20 years. Every year we recruit peer educators and student volunteers. The biggest incentive we do is a certification, a qualification, which is the biggest need for them. That helps them in their employability. They go with some health and wealth. Some people also diversify into health care eventually, even though they did not are in the system for healthcare industry. So I think the qualification is a very big incentive. But the other thing is South Africa is a country where these epidemics are so enrooted into communities that these children or these students who enroll have family members of themselves being affected with this pandemics, and they come with that passion in it. We do also have an incentivization model, curriculum books. We give them scholarships a little bit. We have some kind of stipend like vouchers that we give them per month. But more than that, it's a qualification that brings them together.
Okay. And then does the health check need a smartphone? Because not everyone has a smartphone.
No, health check doesn't need a smartphone, any device, because it's also available on USSD. And USSD does not require a smartphone. It's *1332* star and hash, and then you can still go through it, and absolutely free. So all I'm trying to say is you do not need, and that's what we built it. And that was where and I must say, this is all built in 1 month. We launched it in end of May, and the pandemic only hit South Africa. So I really thank the team, the developers, and it was quite clever of us to put this in a way that we knew the question that you've asked is a reality for South Africa.
Yeah, then it's certainly impressive that you stood up the application that rapidly. And then my last question was about the service providers. So you said we didn't expect it to go on until September, but here we are in June. Have you had to renegotiate with service providers, and how open have they been?
So I must say thank you to them listening to me, and old contacts do play a role eventually. Yeah, so when we only budgeted till September, the first thing was our website got 0 rated, and thanks to the service providers again, which made it the website go, because this system could be linked to the website eventually. But most importantly, they discounted our SMS's rate quite drastically down, because when you're issuing some passport, you have to issue with some return back dividend. With WhatsApps and stuff, it's mostly the licensing fee and the whole holding back technology deliverables. And when it comes to USSD, you're looking at SMSs. But we're also grateful to private sector and the European Union government, along with our own South African government. And so because it's so many partners have put investment to the success that they've seen with so many young people buying into it. You know, when your beneficiaries are happy, the money is unlimited. It's just the medium where the beneficiary should be happy. So all falls in place if things are fine. So we have secured investments as far as 2023 for running this platform, because we do see that we need to be safer for this pandemic and continue our work. And now we're adapting this platform for vaccines and vaccine passports eventually, gradually, once the vaccine rollout starts becoming effective into our kind of populations, when that's going to happen.
Thank you very much. I must say it's very impressive, and I wish you all the best going forward with that.
No, thank you very much.
Thank you.
Appreciate it.
Thank you.